Okay, so we're going to look at the gastro complex now. We did a little bit of release work before with the previous video with the soleus, and now we're going to focus on that gastro because the two really are connected really in terms of this whole posterior tightness, and obviously that can feed back into the foot itself. So let's be mindful that we're going to separate these two muscles. So doing the soleus as we did before, we're coming in that lower half of the leg here. So we're going to concentrate in the upper half, which is where the belly of this muscle is. Keep in mind the gastro is the explosive muscle. So when we are sprinting, we're using this more than we are sort of the soleus. So it pays to the fact that Mon is a 400 metre runner and also 200 runner. She's going to be using that gastro a fair bit. Once again, I like to separate lateral and medial heads and like to concentrate on those. This time I'm just going to do more of an oblique longitudinal glide, once again doing some passive release techniques. All right. So once again, I like to have the foot off the table so I can use it, work through the range of movement and challenge the tissue at the same time. Right, so foot placement is pretty important. So you need to be off the table, make sure that you can dorsiflex, so you're not hitting the table. You're going to come in with braced fingers, okay, hand over the top, okay. So be mindful that we're not going to put a lot of pressure right through the middle of the gastro, okay, obviously because we've got that deep tibial nerve through there. So we're going to come up and through that gastro. Remember to take it all the way up and then across the popliteal area, but not into the popliteal area. Once again, pick up that gastro, purposeful, remember, look at the speed that I'm traveling here. Keep in mind your client's pressure, comfort, working right along that tissue all the way across and up and over, okay? Same scenario again. Cross, up and over. Now, I'm going to swap over now. Hit that medial head now. So I'm going to use the left hand here. Same scenario again. Hopefully I don't massage any flies into the calf. Now you will find that the medial head houses some nasty little trigger points in. Not that the lateral does, but the medial tends to have a lot more reactive ones anyway. So just be mindful if you are hitting those, you can stop and work onto those. But at the moment we're just addressing Monica's load to deload that tendon. Okay, slow, purposeful, introduce the range of movement. Don't rush through it. Worst thing you can do. Beautiful. And the Premax cream works perfectly for that. If you're going to use the lotion, then obviously you're going to be looking at a larger area. All right, that's your gastro complex.
So if you even remotely enjoyed some of that content, please do me a favor and hit the like button below, just so that I know that you did enjoy it. Also, if you don't want to miss out on any of the content that we put up on a regular basis, then the best way to do that is obviously just to hit the subscribe button. So it's a bit of a no-brainer. But most importantly, if you really want to see the true show, the real show, take the opportunity, hit the link below, stuarthinds.com. That's where we have all the comprehensive assessment, treatment of a whole range of conditions. That's where we have our online courses and obviously our mentoring and so forth, the webinars and our podcasts. So if you're even remotely interested in what we do, go and check it out. Appreciate it. But also, most importantly, again, just be awesome at what you do.